If you have asymmetrical, uneven shoulders and one shoulder is obviously depressed and sagging and drooping lower than the other one, I've made this video to help you with your shoulder problems. We're going to go through step by step all the things you need to know about a sagging, drooping shoulder so that you can fix it yourself. Some people out there have very complex, crazy, and weird jargon to explain why this happens, but we're going to skip all the nonsense and just go right into the obvious, clear, easy details. We're going to talk about your rib cage. We're going to talk about the scapula, which is that chicken wing bone back there. We're going to talk about how to reprogram good motion of the scapula and the rib cage. We're going to talk about how you can do pretty much all of this at home on your own with minimal equipment so that you can get your shoulder sitting even with the other shoulder and functioning the same way as the other shoulder. And before I forget to ask, what brought your uneven shoulders to your attention? Why are you concerned about that sagging shoulder? Drop me a comment down below. Everything you're about to see in this video is a part of the Shoulder Fix program, which I invite you to check out at uprighthealth.com/shoulders. It's a comprehensive program to help you rebuild your shoulders at home. So if you've got shoulder pain, uneven shoulders, or you just want to be able to put your arms up overhead better, make sure you check out the Shoulder Fix program after you're finished with this video. Or if you just want to see this whole video without ads and interruptions, you can just start the Shoulder Fix program and you will get this whole video with no interruptions whatsoever. All right, without further ado, let's get your drooping shoulder fixed. Let's talk about what to do if you have uneven shoulders, and more specifically, if your right shoulder is drooping lower than your left shoulder. This is the most common presentation because most of the world is right-handed. Most of us are going to be writing with our right hands, which causes us to adopt a certain drooping posture. And even if you're left-handed, you might still be using a right-handed computer mouse, which is going to generally tilt you down and to the side to use the mouse. So we're going to talk about some things to look out for regarding your rib cage, regarding the rest of your body, and how you can reprogram the shoulder so that the shoulder blade and the shoulder joint are a little more even with the left side. And if you happen to have this issue on the left side, then you can just reverse and flip all of the things I talk about in this video. All right, so let's start off first with what's going on with the rib cage. The rib cage is the foundation on which your shoulder blades rest. So if your rib cage is twisted in one direction or the other, it's going to affect the position of the shoulder blade. If you watch here, if I just tilt my rib cage to the right, this shoulder is now obviously sitting lower than the left side. If I'm tilted this way, it's reversed. If I have a rotation of my rib cage like this, it's also going to affect because the rotation is almost always going to be coupled with some side bending. You're not just going to have like a very pure rotation. You'll probably have been doing something like this or something like this. For right-handed people, generally, unless you have some other activity that might be twisting you up, you're probably going to be twisting to your right. So your rib cage is going this way, which then means your shoulder blade is going to be wrapped around. It's going to be protracted, meaning the shoulder blade is further away from the spine. So instead of being here where the shoulder blades are roughly even, hopefully they're even, I can't see right now, but if I tilt like this and twist to my right, and I still want to feel like I'm facing forward, my shoulder blade wraps around like this. So when you view it from the front, I've twisted my rib cage to the right, but in order to stay kind of square, my shoulders are now in kind of alignment in this plane, but this shoulder is now sitting much more forward and it's sagging and drooping in order to get to that forward position. So if this right side is drooping, we can't just do a bunch of shrugs to try to elevate the shoulder. We need to also make sure that the rib cage is as neutral as we can get it, as symmetrical as we can get it, and then get the shoulder blade position to be more symmetrical so that things line up and feel even and function more evenly. All of us have some asymmetry in our bodies. There's no way to fully avoid it. When you have a droopy shoulder, an uneven shoulder like this, you're going to have some obvious functional differences in the muscles that control this shoulder blade. So the muscles that pull the shoulder blade in, the muscles that allow for elevation and depression are likely going to be functioning a little bit funny, and you're also going to have some trouble with the lower traps keeping that shoulder blade, that lower angle, glued down to the rib cage. So you might get some winging because when you're in this position and you're trying to use your arm, that lower angle of the scap might start winging off the rib cage just because it's always sitting in this weird droopy position. Sorry I used the word weird, it's not that weird. It's pretty common, but it's not ideal. So we want to first get the rib cage to be as level as we can get it, and then we want to restore and retrain some of the motions that the shoulder blade is supposed to be good at from this more stable base. So your first step in fixing a sagging, uneven shoulder is to look at your belly button and your sternum and determine what your rib cage is doing. So you can just stand in front of a mirror, your belly button and the sternum, the center of your chest, should be in a pretty straight line. If you look in the mirror and you see something like this, then you know you're twisted and tilting over to the right. If you see it like this, then you know you're going to the left. You don't have to overthink this, just look in the mirror, look at the orientation of the sternum, don't get fooled by everything else, and don't waste all your time staring at your nipples. Once you've determined which way you're twisting, you're going to go to a wall and we're going to lengthen and strengthen some muscles to help you get out of that twist. So let's say you're twisted to the right. Well, then you're going to take your right hand, you're going to put your hand on the wall somewhere around head height. You can play around with this. You can even go low over time, just explore, but somewhere around head height to start. Your right foot is going to be back, and you're going to position yourself so that you are in a twist to the left. And then you can play around with bringing your shoulder and your rib cage closer to the wall, getting a stretch along the back of the shoulder here, and also going down along the lats down into your low back. You can also try sticking the ribs out a little bit and bringing the ribs in closer to the wall. So we're trying to do everything we can to counteract the twist and the tilt that you're normally in. So I'm now twisting left and tilting the rib cage to the left, and that's challenging muscles all along the ribs and along the spine and along the back of the shoulder here. So I'm just checking to see what's restricting me. If you are somebody who is twisted to the left, you'll do this the opposite way. Your left hand goes up, left hand goes back, and then you'll start looking for those same stiff, tight areas. Okay, so you're gonna hold this stretch, you're gonna look around for whatever is restricting you, whatever's keeping you in that rotation. You're gonna keep trying to go a little bit further into the opposite of your normal rotation and side bend. So now I'm side bending, I'm rotating left. You're gonna play around with head and neck position because you want options here. Just be gentle and slow about it. Make sure you don't feel anything tweaking. Just take your time, 30 to 90 seconds, and then when you feel ready, you can come out of that. What did you learn about your rib cage? Does it tilt and twist to the left or to the right? And how did it feel after you did that stretch? Drop me a comment down below. And now let's move on. And then you're gonna do some strengthening to really solidify that ability to create that twist. So then it's a very similar setup. You're gonna have your hand on the wall. You're gonna be facing parallel to the wall roughly. And then you're going to be accentuating that twist by putting pressure into the wall. So I'm leaning into the wall here, pushing into the wall, I'm pushing here, and I'm just trying to stabilize my body here. So I'm gonna be using my obliques, I'm gonna be using my QL, I'm just gonna be using a lot of muscles on the side and all up here. I'm gonna be opening these muscles here on the side some more and play around with the angle. You can have that hand lower. You can be a little more upright. Just get used to creating force into the wall in that twist. And you can accentuate the crunch a little bit, have less of a crunch, All of these options are fine. Play around with angles. If you want to get really twisted, you can go in like this. You want to be a little less twisted and this feels good, that's fine. You're just trying to hold this and get a little more stability in that position so that your ribs are learning how to be stabilized to the left if you are already on the right. Or if you are going to the left, then you can do the opposite with your left hand on the wall and stabilize and get the muscles to work on your right side. So I would encourage you to explore here for about a minute to 90 seconds on each side, and then we're gonna move on to the next exercises that are gonna help us reprogram the shoulder blade and the shoulder joint. Now that the rib cage is in a more neutral position, we want to start introducing scapular motions like scapular retraction. So remember again, you're normally here, that shoulder blade is protracted, meaning it's further away from the spine. So we want to start teaching it and reminding it to retract. So the rhomboids, the muscles that pull the shoulder blade in towards the spine, need to be woken back up. So simple way to do that is just standing and retracting that shoulder blade. While you're doing it, you might as well do both, but really focus on feeling that right side moving if it's your right side that's drooping. Another option with this is to have your arms out to the side like this, and then pull the shoulders back, pulling the elbows slightly back. You really want to feel the motion of the shoulder blades. For many people, you will find it very difficult to even feel muscles working on that right shoulder blade, and that's normal. Just keep going until you can feel some fatigue back there. Whatever configuration with your arms works is fine. Just focus on the squeeze and then relax. You also want to make sure that you're not just lifting your rib cage up when you do this. A little bit of feeling of puffing is okay because you are opening up the chest, but you don't want to be just doing this, right? And fooling yourself into thinking you're doing scapular retraction when all you're doing is just extending your spine, arching your spine, right? So shoulder blades need to be moving like this. Hopefully you can feel those shoulder blades moving, and you can do this just throughout the day to wake up those muscles. And you can then start working on doing a little more of a challenging exercise for those scapular retractors with a little bit of weight. And I'm going to show you a couple options. One simple option is to get some sort of weight like a dumbbell, a kettlebell, or a backpack with some water bottles in it. And you're gonna have one hand on a sturdy piece of furniture or weightlifting equipment like a bench. You're going to try to get your body as parallel to the floor as you can. And then you're going to pull that weight up towards the ceiling by pulling the shoulder blade back. So in the resting position, my shoulder blade is kind of sagging down, it's protracting, and then I'm gonna pull up like this, and I'm gonna pause at this top position, waiting to feel a little bit of activity between my shoulder blades, meaning the retractors of that right shoulder blade, and then I'm gonna come down. Couple things you want to pay attention to. You don't want to just be shrugging towards your ear. So as you're coming up, you don't want your shoulder to be hiking up and then feeling all this close down. You might feel a bulge of muscle kind of hitting you in the back of the head. That's not what you want. You just want this to be a clean motion where the shoulder blade is getting pulled back. Another thing is to make sure you're not just like heavily arching like this as you pull. You want to just keep the spine steady and stable as you're moving through this limited small range of motion. It's not a big thing, okay? So you're gonna do this 10 to 20 times. Start off with a light weight, start off with 5 pounds, start off with 10 pounds, and then just gradually increase this weight as you feel you can tolerate. The heavier the weight you use, the easier it's gonna be to retract your shoulder blade when you need to, when there's no resistance. And if you have training bands secured to a nice stable anchor point, or you have a cable machine at the gym, you can do this same exercise. You'll have your arm out in front of you, and then you'll be retracting the shoulder blade. Again, thinking about not shrugging the shoulder up towards the ear or dropping the head. You're just pulling that shoulder blade straight back towards the spine, letting the band or the cable pull you, and then pulling it back, holding, feeling that contraction, and then letting it win. You want to do these slow and controlled, around 10 to 20 repetitions. Really focus on feeling the fatigue of those muscles back here, those rhomboids and the middle traps pulling. In terms of foot position, I would recommend having the same side foot in front and the other one staggered back. That makes it a little easier to keep the low back out of the exercise. So when you're standing here and you're pulling, sometimes you're gonna wanna arch your lower back, and having this front foot on the same side as the pulling arm is gonna make it easier to stop any extra cheating from the low back. But if that doesn't feel stable for you, it just doesn't feel good for you, then you can try doing it this way. It's not that big a deal. Just figure out which one helps you get the cleaner retraction of the shoulder blade. Just a reminder that if you want to rebuild your shoulders at home, go to uprighthealth.com/shoulders and start the Shoulder Fix program. You can get this full video with no ads, no interruptions whatsoever. Go check it out when you're ready. uprighthealth.com/shoulders. The next thing we're gonna do is practice scapular elevation, meaning we're just gonna be bringing the shoulder blade up and down. I'm doing this with 2 dumbbells because it helps me feel a lot more balanced and more even. You can do this with just 1 dumbbell if that feels like the right choice for you. Just put 1 down and then just shrug that one side, totally fine. You wanna practice doing this with scapular retraction as well as just being in a more neutral position. But when you're first starting, I definitely want you to practice doing it with some retraction so you can get used to moving up and down with the shoulder blades with the scapula pulled back. Then as that feels more and more comfortable, you can also train it in just a neutral position, because normally that shoulder is rounded forward here. We're just kind of overemphasizing the retraction just to reprogram things a little bit, and then you can come back to a more neutral position over time. Ultimately, with all your training, you want to be creating more options for yourself. So currently, you're limited because you're sagged in here. So we want to really train the opposite and make sure that those muscles that control the shoulder blade know how to create elevation in that retracted position and the neutral position. When you're getting up to the top, make sure that you're holding and really feeling those muscles work, and then coming back down. Find a pace that feels doable and comfortable for you. Use a weight that lets you do about 10 to 20 repetitions before the fatigue starts to really kick in. You don't have to burn this out super hard. You don't have to go super heavy. And the upper traps actually blend up into the fascia and the muscles around the skull. And if those get overly worked, you can give yourself a proper headache and a lot of neck tension. So keep it at a lower weight, higher repetition for now, and just don't overdo it. And let me show you another option for scapular elevation in case you have something called downward rotation. So this is the right scapula. This is the lateral edge. This is your arm bone. Downward rotation of the scapula is when this lateral edge is down like this, so then the medial edge is higher. So that would look something like your shoulder is like dropping down here and the scapula is downwardly rotated. So if your shoulder blade is stuck in downward rotation, we want to practice getting upward rotation. So this exercise is going to help you do that. You're going to be kneeling on the floor, same side leg in front. That seems to work best for me, but you can try the other way as well. You're going to have a dumbbell here and you're going to come up towards the ceiling, getting that arm nice and vertical. And then you're going to shrug up. So you're pressing that weight up overhead and then back down. Press it up overhead, hold it there. Really feel the muscles of the upper shoulder working. You might feel some stretch out here and back down. Up and back down. You can also play around with the grip you have on the dumbbell. So a neutral grip is what I just showed you, but you could also go to this twist where you're more supinated, and when you're here, as you're pressing up, you might feel like it helps you engage the muscles that control the shoulder blade a little bit better. Helps lock things out a little more, but figure out what works for you. If you feel any pinching or jamming, doesn't feel comfortable, don't do it, obviously. But this setup with the arm going overhead helps you get a little more upward rotation of that shoulder blade. You've got the arm going up like that, really reaching, it helps put that scapula into more upward rotation. Now we want to activate the lower traps, which are going to help pull the lower portion of the shoulder blade in towards the midline. So to do that, you can either be kneeling or you could do this standing. The important part is to just work on the angle here of your torso. It's going to be inclined forward, and you want to keep your spine basically still throughout the motion. You're going to have your arm angled out to the side. It's going to be roughly 40 to 60 degrees away from this perfect parallel position with the direction of your body. So it's not here, but it's somewhere around out here, and you're going to have to find the angle that helps you feel your lower traps firing. So you're going to be down here, or leaned up against something if you're standing, and then you're going to be lifting that arm up and slightly out to the side and hold it out there and back down. Please experiment with the angle, because you're going to find an angle that really lights up that muscle. If you go too close to this perfectly parallel position, you're not going to feel it. So make sure you're out a little bit to the side and find the right angle that works for you. Hold that top position, breathe, and then back down. You're going to do these to fatigue, hopefully somewhere around 5 to 15 repetitions. When you feel like you can easily do something like 15, then add a light weight. You really don't need to add a lot of weight to make this hard, because you've got your whole arm, which is long. It's going to make that weight feel super heavy. So just out to the side, and up, hold it, and then back down. Really try to maximize that range, getting it up and really feeling those lower traps firing. I like doing this on the floor because it means I can get my hips back and really feel like I'm keeping my lower back out of it. If I were to be more shifted this way, I might use my low back too much, and standing, that's always a really big struggle for me. So being down in this position means I'm really focusing on feeling the lower traps. I'm not feeling a lot of engagement of the low back, and that keeps it nice and clean and helps the shoulder muscles, the shoulder blade muscles, work a lot better, rather than feeling the spinal muscles giving me extension. Another thing you can do to reduce some compensations is to rest your forehead against your other hand. That will mean you aren't shrugging so much. You're not having to think about positioning your head so much. It's just right there. And then you can really focus on feeling the lower traps instead of the upper traps or anything else that might want to try to kick in. I do encourage people to do this exercise on both sides because it really helps with your shoulder health in general. Just make sure to do extra reps or a full extra set for the side that needs extra attention. Hey, I hope you're understanding everything up to this point. If you have any questions that I haven't answered, please drop them in the comment section down below. And I also want to remind you that you can get this full video as well as many other detailed follow-along workout videos, as well as a comprehensive schedule to help you rebuild your shoulders at home with the Shoulder Fix program at uprighthealth.com/shoulders. I invite you to check it out either right now or when you're done with this video. All right, let's get back to it. And finally, it's a great idea to work on active and passive hanging on a pull-up bar. If you don't have easy access to one, you can usually get a pretty inexpensive one that fits in a doorway in your home. So you just need to grab a hold, and when you first start, I recommend you use a step stool or something that allows you to stand so that you don't put all of your weight into your hands and into your shoulders. If you've never done any kind of hanging in the recent past, then your shoulders and hands need time to acclimate to this. So first you start off with some passive hangs where you're allowing your weight to pull your shoulders up towards the sky as your body drops down towards the floor. So you can attenuate this by using more or less help from your legs and feet, with the ultimate goal of being able to just hang without any feet touching the floor or the step stool. So you're just allowing the muscles all around the shoulders to lengthen and get used to a really elevated position first. Then you can think about doing active hangs where you're pulling your body up towards the bar using those same muscles. And then you slowly go back down. Again, when you're doing this, I suggest using a step stool to start because the muscles that control this pulling are going to be pretty weak if you've never done this before. So as you're pulling up into this active hang, you are working on scapular depression because your scapula are moving down towards your butt. And then when you are hanging in this more passive position, that's when your scapula are going up into elevation. Then you pull, you're actively hanging, the scapula are depressed, and then back down. Now, obviously I'm doing this with both sides active. If you feel like your one side is much weaker or you want to experiment with this a little bit and see if one side is weaker, you can do this with just one hand at a time. Just make sure you've got assistance from your feet and legs, like I mentioned earlier. And then over time, you can be working these depressions and elevations with no assistance from your legs. So if either side feels much weaker than the other side, if you know, hey, this saggy side, now it's getting better, but it just feels really weak in this range of motion, work it, give it extra help. The idea with all of these exercises is to improve your control over the full range of motion, not just try to optimize for one position where you're just standing and trying to get everything to look perfect standing. You want to have control everywhere, and you want to be looking for obvious asymmetries. As you correct them, you start getting your body feeling more balanced and more strong and supple. That goes for all of the exercises in this video, not just the ones on the pull-up bar. You want to be finding the areas where you're weak and building those back up so that you have balance and control through a full range of motion. Now for these exercises on the pull-up bar, for the passive hang, you want to be able to hang for at least 1 full minute without any assistance. So that's what you're building towards, but don't rush towards that goal. Give yourself time, give yourself assistance, and just build up to being able to do a full minute. That might mean you're just doing shorter holds, like 5 seconds, and then you take a rest, 5 seconds, take a rest, and building up to a minute. It might mean doing 20-second hangs in chunks until you get to a minute, until eventually you are able to just hang for 1 full minute. But be patient because your hands, your wrists, your elbows, your shoulders all need to get used to that. With the active hang, you want to be able to do these slow and with control and do it to fatigue, somewhere around 5 to 15. If you're doing a longer hold at the top where you're actively just keeping those scapula down, then you might only do a set of 5. If you're just getting up there and coming back down and really going in and out, then maybe that's going to be 15 reps. Play around with the options, see what your body is good at naturally, and challenge it to do the things it's not so good at. So you might find like, yeah, I can do this pretty easily with quick repetitions, but if I just hold it, maybe, oh, those muscles tire out so quick. Then you want to start focusing on the stamina and the ability to hold that position. And of course, if you're playing around with the one-arm versions, same idea. You want to build up the range of motion first, and then you can practice building up the stamina to hold your body in those positions. So to recap, you want to assess whether your ribs and spine are tilting and twisting to the right or to the left, and then you want to stretch that out and strengthen the opposite. Once you've done that and gotten a stable base for your ribs, you're going to work on scapular retraction. After you've worked on retraction, you're going to work on elevation with that overhead shrug. Then you're going to work the lower traps to help you control the shoulder blade while you're getting into shoulder flexion. After that, you want to work on hanging, including passive and active hanging, to improve both scapular elevation and scapular depression. While it's not a top priority early on in the process of getting your shoulders level, at some point you're going to want to train protraction to make sure that you have good function and good control of the shoulder blades in all the motions that it's supposed to be able to accomplish. So when you feel like things are starting to get a little more even and control is feeling much better for retraction, elevation, and depression, you might want to throw in some things for protraction. A simple way to do that is to just get next to an elevated surface like a bench or a chair. If possible, I recommend having the fingers pointing down towards the floor so that the arm is supinated with the pit of your elbow pointing up. This helps you really focus on the motion of the shoulder blades and not so much of the motion of the arm. So this kind of locks things in place, and then you can let your body come forward towards the surface and then push away. So you're really thinking about the shoulder blades spreading apart, moving away from the spine. So you're just going in and then out, really focusing on this out position and stabilizing it here. You want to make sure your shoulders are not elevating accidentally, that your spine is not cheating to try to fool you into thinking you've done the motion. Film it, get a mirror, watch it from the side, and try to get it nice and smooth and even. The higher the object that you're doing this on, the easier it's going to be. So if you're doing it here, you're effectively doing it with less weight. And if you're doing it all the way on the floor, you're gonna have maximum resistance because it's gonna be your body weight and gravity. Now, this may be really hard for you depending on your wrist mobility. If it's a challenge, you can use something like yoga blocks and you don't have to go into as supinated a position, but you could just go on yoga blocks to something that's close to that position, or you could use dumbbell handles so that your wrists don't have to bend at all. You could also do this with a cable or a band, just having it behind you and then pushing forward like this if you want to do one side at a time. And if you do this exercise one arm at a time, make sure to do both sides and maybe do an extra set for the obviously weaker side. Whatever way you train this, make sure that you feel a clean protraction of the shoulder blades and that you're not compensating as you do more reps. So you can do 5 slow reps, you could do faster reps, get to 15. Just make sure you're working to a fatigued level where you are feeling some challenge, but you aren't losing solid control and coordination. And while protraction is not a top priority right when you're trying to level your shoulders, it is important to train it at some point. That's why it's included in the Shoulder Fix General program. I hope this video helps you out, and if it does, please share your success story in the comment section down below. It will really help inspire somebody who comes along later and discovers this video. It will also help them discover this video, so you can do your part by just leaving a comment, or you can hit the like button or the subscribe button, or maybe both, because that'll help me out and it'll help me make more videos like this to help you. And finally, I encourage you to check out the Shoulder Fix program at uprighthealth.com/shoulders. As always, I hope you remember that pain sucks, life shouldn't.